going to go through this Estim machine with all 4 different types of stimulation. First one is the interferential. Both channels need to be selected because of the quadrupolar that we need. Amplitude you can change. That just means if you set the beat frequency to 100, 40%, it's going to go down to 60 and back up to 100. If you set it to 100%, it's going to go from 100 all the way down to 0, back up to 100. Static, it'll just statically stay at 100. 40% may be more comfortable for someone who is older and is not used to the buzzing sensation. Once they
it helps to prevent accommodation.
And helps to prevent accommodation. You can set it on static and let it ride out. Or I guess we want to prevent accommodation, so let's set it on 40%. Beat frequency, you want it to mimic conventional, so 80 to 150 is good. Or you can set it yourself if you want to set a high or low, or if you would like to fix it at a certain level. 100 is normally what we use. Setting it at an unfixed will also allow it to modulate between 2 different numbers, or a set of numbers, so that you don't get accommodation. You set it up quadrupolar, and time is here. If you want to change the time of the treatment, 20 minutes to 30 minutes is usually a good treatment time for pain relief. In the clinic, they can have one at home that can go up to an hour. You will turn up the intensity to something that is a buzz, does not cause a muscle contraction, that's strong but comfortable for your patient. Once that intensity is set, press start, and the time will start counting down.
And make sure you know which channel it's on. So
Both channels, yes.
Oh, for IFC.
IFC should be both channels, however you can change it.
Okay.
The next is pre-modulated. Do note the channel that it is on. Since it is on channel 1, you cannot change it. Make sure you pick channel 1 lead as the ones on it. With pre-modulated, we want to evoke a contraction because if you were using this for pain relief, which you can do, it only uses one channel. You're going to get a small area that is getting treated rather than using the IFC with a larger area. So we can change this. For muscle contraction, again, you can change any of those. I guess looks like you only have 5 out of 5 as a choice. So 5 seconds on, 5 seconds off on this one. You can change the beat frequency. Since you want a muscle contraction, you want it fixed. And depending on what type of muscle you're using, if it is a postural muscle, you want it more around 30 hertz. If it's a fine motor, you want it more around 50 or 60. So I'm going to use a fine motor. I'm going to set it at 50.
50, right? Not 60.
50.
Okay.
Yeah, it's between 30 and 50. So I'm going to set it at 50. Again, you want to change your time. Since you are looking for a muscle contraction, you would like 10 contractions, just like if you're working out. You do a set of 10. We're only 5 on, 5 off. So you might want to change the treatment time depending on what you want.
50 off.
Can't
10
change.
on, 10
This
off.
one you can't change. Do the continuous 5 on 5. So you may want to do it more of like 5 minutes.
So that would give you how many contractions? A contraction every 10 seconds.
Yeah.
So
Before you press start on any of these, make sure you turn up the intensity, because what's going to happen is you press start, you'll start to turn up your intensity, and it's be on for 5 seconds. As soon as that 5 seconds over and you're still trying to turn up the intensity, it's going to go off for 5 seconds, and you can't turn the intensity up while it's off for 5 seconds. So you'll only be able to adjust the intensity when that on cycle is on.
window.
So adjust the intensity until they get a strong muscle contraction. Then press start, the time will start ticking, and it will go through that cycle. Hivolt, With Hivolt, again, you're wanting a muscle contraction. The frequency is going to be based on the type of muscle that you're wanting to contract. If I want to do a postural muscle, we're going to do 30. Ramp is good at setting at 2. It's going to take 2 seconds to get up to its max voltage and then 2 seconds to ramp down out of the max voltage.
Why do we do that?
It's more similar to how you contract your muscle. You don't recruit all at once. It kind of phases into the contraction. Treatment time for muscle contraction, you probably want more like 10 minutes or less.
So the only thing we change really is frequency.
And cycle time.
Okay.
Muscle contraction, you can use any of them. 10 out of 20, 10 out of 50. I tend to travel to those.
So 1 every 30 seconds.
Yes. And increase your power intensity. 2, you get a muscle contraction, and press start. Last one is Russian. Russian is actually already set for you 10 seconds on, 50 seconds off. Keep it at the frequency of 50, a ramp of 2, and a duty cycle of 50%. Again, make sure you're on channel 1 with the leads. You can turn this down to 10 minutes so that you're getting 10 contractions. Turn your power up to get a strong contraction. Press start.
What is the duty cycle?
Duty cycle is...
Oh, so that's the on. Hold on, sorry.
It is the time that you are receiving. So 50% of the time, if you set it for 50%, would be the time that you're receiving the treatment.
Okay.
I don't know why you would change it. That's it.
And so then with the 50 beats per second on this, we're doing Russian on a fine motor
Yes.
muscle.
Muscle.
Hey, how many layers does this count?